we right away go into the next presentation, which will be done by Java, Seromondo of Rwanda, and is looking at the performance-based approach to accelerate hepatitis C elimination in Rwanda. Thank you.
Distinguished guests, ladies, gentlemen, dear colleagues, good afternoon once again. I'm back. I'm replacing my colleague who was not able to travel and present this abstract, but I'm a co-author, and then I'm happy to present this abstract titled Performance-Based Approach to Accelerate Hepatitis C Elimination in Rwanda. The performance-based approach is an approach which is used in all sectors in Rwanda from 15 years ago. So it's meant to accelerate the implementation of plans by different institutions and then to contribute to the overall development of the country. This abstract will be different. The previous one has been technical. This one will be managerial. Oh, some of you may say political. Let's go through. Good luck. So I can't have the next slide. Oh, next, please. I will present it in two different parts. The first one will be a linkage between the performance evaluation approach and then the program. And the second one will be the lessons learned. In my next slides, I will use the word imihigo. Imihigo is just a Kinyarwanda translation of performance evaluation approach. Hopefully you will be able to learn a single word of Kinyarwanda, and it will be part of the deliverables of this COLDA 2022. IMIGO are defined as public service performance contracts that originate from Rwanda traditional systems of accountability. They are sets of objectives with targets to be achieved during a given period. Usually it's a fiscal year, a period of 12 months. And then at the beginning of the fiscal year, different institutions, leaders at all levels are assigned imihigo. I recall that imihigo is a performance contract. I don't know if you recall that. So imihigo is Nyarwanda word to define performance contract. Since 2006, imihigo have been adopted as a tool for good governance and accountability. Since 2020, viral hepatitis screening has been included in that system of performance contract. We had a target of screening 7 million people across the country. The 7 million people come from 12 million as a total population of the country, and the 7 million are people that are aged 15 years and above. That population is distributed across all districts of the country, and we have 30 districts across the country. Each district was assigned specific targets per year of people to be screened during that specific period. Then the preparation and implementation of imihigo comes from the national priorities. And the national priorities are always defined during high-level meetings, and we have an annual national dialogue which always is attended by high-level leaders, heads of institutions, and then That's where the national priorities are defined. Usually, they are also linked to the global priorities. And then, when the national priorities are defined, they are communicated to different ministries, and the ministries communicate them to different institutions, and they are cascaded. Then there is an identification of local priorities by different entities of the local government. The local government is the ministry which is really involved in that implementation of Imihigo, because it has different entities which are administratively different. We have districts. Yes, let's start by the national level. We have provinces, we have districts, we have sectors, we have cells, and we have villages. And priorities are identified locally based on the local context. Then there is a phase of implementation, and we have always 12 months to implement those targets. At the end of the fiscal year, the leaders, the institutions are evaluated, and then scores are published, and then some people have performed, others not. There is also a national evaluation of Imihigo, and best performers are recognized and rewarded. Coming back to our viral hepatitis elimination, this is the map of our country, and you can see the 30 districts with boundaries. It's showing how Imihigo were performed, especially from July 2021 to June 2022. That's the fiscal year. Some districts performed well, others performed at least at 80%, 90%, others went to 100% and beyond. Considering the duration of the assignment, we had 3 years. On the left side, from 2016 to 2019, 1.5 million people were screened during that period. However, from 2020 to 2022, the same period of 3 years, 5.5 people have been screened thanks to the introduction of Imihigo. Regarding the numbers, you can see that the number of people screened from 17 to 19 is 1.5, as said. And on the right side, we have higher numbers, 5.5, because of the acceleration by Imihigo. Then, lesson learned. I can summarize the lessons in 2 words: readiness and acceleration. Before the initiation of Imihigo, we need just to be ready. Imihigo have produced a lot of patients needing viral load test, treatment, and so on. So we needed to be ready in terms of having trained healthcare workers, decentralized services, and availability of tests and medicines. We needed to be ready in terms of data management, because the screening of that huge mass of people produced a lot of data. So the data needed to be managed. On the other hand, Imihigo performance accelerated the process, and Imihigo is the best approach to accelerate any implementation of plans. Thank you very much.